Today we'll be demonstrating the placement and impression technique for the Dentsply or Astra direct or stock abutment. I oftentimes will place these for restorative guys, but certainly they're easy enough to place if you'd prefer to do it yourself. If you're placing it yourself, when you see the patient, there will be a healing cap in position, which is not present on our model. It's a simple matter to remove the healing cap with finger pressure. The implant will already have been checked for stability at my office prior to you seeing the patient. Once the healing cap is removed, you'll choose your abutment height, and with the Astra or Dentsply system, it's based on implant collar height. You want the collar to be approximately 1 millimeter subgingival. So you basically just hand tighten the abutment onto the implant. Prior to torquing it to complete torque, I would recommend checking occlusal clearance to make sure that you have enough occlusal clearance to do a standard abutment. Once you hand tighten and check the clearance, then you re-engage the screwdriver, and using your Dentsply torque wrench, you will torque it or tighten it to 25 Newton centimeters. All the EV components are all 25 Newton centimeters now, making it a little easier for us to contend with. Once it's torqued to 25 Newton centimeters, you will take the impression. Now, if I'm placing the abutment, the patient will arrive with the abutment in position, and there will be a protective cap that is snapped into position as a clear protective cap for the Dentsply system. It's a snap cap, and it's a simple matter then to remove the snap cap to take the impression. The impression components will be in the impression kit that I supply you. In addition to the gray snap cap, there will be a clear burnout coping for your lab, as well as an lab analog. So the impression snap cap for the Dentsply system is a single piece system. There is a dot on it that lines up with the flat side of the component on the inside. That then coordinates with the flat side of the abutment. In the Dentsply system, the flat side of the abutment will have the number height on it, which are always 5 millimeters in this situation. So you want to make sure you have the dot lined up with the flat side of the abutment. And once it's lined up, finger pressure to seat it. You will feel and hear an audible snap in this system, and it should not come off easily. Once it's placed, it's a simple matter to take your impression. You will inject light body around the impression coping and seat your tray. Once it's set, you remove the tray, and the impression component will come out into the tray, and then you send your lab analog with your lab, and they can seat the analog into the impression component. Once your impression is complete, it's necessary to replace the protective cap. In the Dentsply system, it is a snap cap. However, I recommend placing some temp bond to prevent it from coming loose between the time you take the impression and the time that you seat the final restoration. If it comes loose, it's not insurmountable, but it typically will require a tissue trim, which is inconvenient for you and for the patient. So I would recommend using temp bond just to make sure it doesn't come loose. And that is the standard abutment impression technique for the Dentsply system.